All right, so you're going to divide low back pain into two major categories. One is what we call like static low back pain, and one is kinetic low back pain. So static low back pain, I don't know if anybody ever had to do something like sit in the same posture for a long time. You don't do that, right? So sitting, basically, static low back pain is just postural, where you're doing the same thing repetitively. Sitting can put a lot of pressure on the disc. Actually, sitting puts more pressure on the disc than standing. Right? So then, if static low back pain is one thing where you're not moving, what's the other going to be? Moving, right. So kinetic or dynamic low back pain. And then basically if you're talking about kinetic low back pain, there's two different categories of that. Sometimes there are two different ways that you're looking at the low back pain. Basically there's two different kinds of movements. Flexion, like we talked about before, the main things you do in the lumbar spine is flexion and extension. So certain categories of injuries are going to be related to forward bending. And then they're going to be aggravated by forward bending. Okay? So when we're bending forward like this, what's happening to the disc? Which way is it getting pushed?
Posterior.
Posterior. Is there anything back behind there that can kind of run into problems if the disc is putting pressure on it? Yeah. Either the spinal cord itself or what comes out of these openings here? Nerve roots. Okay, so disc problems tend to be aggravated by forward flexion. And then we're going to talk about nerve traction things. So how do you think you're going to traction the nerves in the low back? Are we going to be stretching back like this? Or are we going to flex forward like this? Right? Well, no. Flexing, because that's going to push the disc backwards. And then also the nerves are on the back part of the spine. So if the nerves are back here and we're doing this is what's going to stretch them. And if you have the nerve roots coming out here, pulling the leg up like that's what's going to stretch it. Okay? What's going to happen when we bend backwards? Okay, what structures are getting compressed when you extend? Oh, what's the bone right here? Yeah, the facets. Okay. So if somebody's having pain back like this, it's going to tend to be more likely facet problems, things like that. Okay, so there's kind of two general categories of flexion and extension type conditions. Okay, so there's some crossover, but at least you want to understand the concept that you can see how most of the time if somebody has a disc problem, it's going to be aggravated by forward bending, sitting. It's going to be sometimes tend to be relieved by extension. That's not always going to be the case, but that's just the general sense. All right, so what kind of inert tissues are we going to talk about in the lumbar spine? And then we'll expand that into the pelvis. So we talked about the lumbar spine, then what else do we have? What other bones we have in the pelvis? Yeah, you have the sacrum, and then you have what they call the innominants, which are combined of three different bones, the ilium, ischium, and the pubis. Okay, and then what kind of articulations do you have in the pelvis? There's two of them right back here.
Yes, I have.
Well, the joint back there. See, what's the bone in the middle? Sacrum. And then what on the pelvis, what are the two bones that are right here? What's the I in PSIS?
Iliac.
Yeah, so sacroiliac joint. Okay, so you have the sacroiliac joints, that's where the pelvis articulates with the sacrum. And then what do you have in the front here? So then, what are the inert tissues we're going to talk about are all those different bones, right? And then what connects bones together? So we're talking about ligament sprains, sprains, right? And then we'll have all those joints. So you can have disc problems, facet joint problems, sacroiliac problems, pubic symphysis. Okay, so the same types of things. And then how are those inert tissues going to typically be injured? Going to be repetitive things or acute? Yeah, usually you can have acute. Again, there's some blending where you can have chronic problems, but ligament tears are usually going to be acute. You can have lifting problems from acute lifting where somebody says, yeah, I've been over and was lifting something like this and all of a sudden my back hurt. Or somebody can do that over and over again, and then finally you do have the one straw that broke the camel's back, so to speak, where you're doing repetitive types of things over and over again, but then you have an acute aggravation of that. And then what about contractile tissues? What are we going to talk about there? Yeah, basically it's going to be muscles. So you have flexors, extensors, lateral flexors, rotators, things like that. You have lumbar strains, okay? You have muscle injuries from lifting, things like that. Then when we get into the pelvis and the hip, obviously there's going to be different things here. You're going to have all the buttocks muscles, you have hip strains, groin pulls, things like that. All right, so what about neurologic? What are the neurologic things we're going to talk about in a lumbar?
Nerve root.
Yeah, nerve roots. And how are they going to get affected?
Compression. Discs.
Yeah, either discs or something that's going to narrow the IVF. So it could be a soft thing that's going to narrow it, which is going to be the disc. And what other bony, hard types of things can narrow the IVF? Yeah. So degeneration, arthritis, either affecting the vertebral plates or facets. You have facet arthrosis, lumbar DJD, anything that's going to affect that IVF opening either by a disc bulging into it, narrowing of the disc, or facet or DJD of the bones, where the bones encroach in onto it. And you can encroach onto the IVF, but you can also affect the central canal. So you can have a lumbar stenosis too from anything on the end plate that's going to go into the spinal cord. And vascular, in the lumbar and the pelvis, there's not a whole lot except, when you get into the hip, I talk about the femoral artery. And I'm sure you can understand that people have injuries to the femoral artery, you can bleed to death pretty quick. There's other things you want to be aware of as far as red flag type of things of the abdominal aortic aneurysms. Right, so that you have the abdominal aorta, it can get bulging in it, and that's a serious thing. Then we'll talk about congenital conditions of the low back. We'll get into malformations, and then we can pass the bones around again. And there's, if you see any abnormalities, congenital abnormalities on any of those bones, you can write your name and put it on a piece of paper, and you might get extra credit points. Right? So when we pass it around, try to find anything that we talk about in here that's when we talk about congenital conditions. If you see anything, then you can write it down. So obviously congenital, when are those formed? Yeah, early on in the situation. So we'll talk about things like spina bifida or spondylolisthesis. But spondylolisthesis can be congenital or it can also be acquired. Anybody, have you heard of that before, spondylolisthesis? Yeah, there's a whole series of different things where you talk about the pars, which is this part right here. Or what can happen is the posterior part can separate from the anterior part. And you have to have both of them separated for the anterior part to slip forward. But we'll talk about that later.